I have been a CVS doctor for 30 years, so if you ask me what's the first cases in the pediatric, but I don't think I can remember it, but I can remember some struggling or emerging cases in the past 30 years. I have a case of the transposition of gray artery. He received the artery switch when he was neonatal, and 7 or 8 years later, the artery root became huge one, and I performed the valve sparing procedure for this boy, and I take about 12 hours to complete the operation, and the operation made me so impression because I take a lot of time to take off all the adhesion, and I also published the paper in the JTCVS, and it is the achievement, and it also preserved the valve for the boy. So I think it's quite amazing for me. If we do something good or with something effort on the patient, he can survive the procedure, and also as well he don't need have the anticoagulant in the long term. So it's my as when I remember this the very impressive procedure. I think we are facing the new obstacle in the recent year because reimbursement problem and the manpower, the anxiety and energy in Taiwan young surgeon no more have this energy. So I think first of all we must improve the working environment and the benefit for the young residency, and most of all we must give him more, give them the innovation for them, because in the past 20 or 30 years we just follow the rule or follow the regulation from the United States or from Europe. For China or for Taiwan, we don't have our principle, and as well we don't have our new innovation. So we can improve in their working environment, but the only way they can help themselves is increase their innovation in the new field. So I will encourage them to thinking more and expose more new technique and new idea. This is the way to improve the whole medical medicine. Okay. This is a very tough question because it not only involve the working hour, also involve the working environment and the nurses and the reimbursement. So I don't have a question. I don't have an answer now because it depends on the individualized, depends on every individual person. If he has the ambition, he will work hard. He do not care about the working hour. But if he does not, he will always argue the working hour. So in the long run, we should have a good system. So we should have a good nurse power and a good reasonable working hour. So you will share the working and the family. I think this generation is not similar to ours before. In in our generation, we working too hard and working too long. But nowadays, it's not a good way to survive. Okay. I will take off. Actually, if tomorrow is my last day, I will not be here. I should, if I know, I should take off, accompany my family, and I think family is the last choice in all the work or the status. This year, I think most important one is innovation in the cardio side. In the cardio, we have some innovation in the gene therapy in the lab, and we also have the new technology in valve, in aortic stenosis, not only TAVR, but also the sutureless valve. And in the chest side, we have more mini invasive and more localization of the small lung nodule. So it will improve the outcome and you improve the technology in the surgery.